Hey everyone, and welcome to the Deep Dive. We're super excited today to be diving into the world of healthcare IT management.
Yes, and a huge thanks to London Heartbeat's Z Academy in the UK for their support. Be sure to check out their 140 plus healthcare courses and follow them on Facebook, Instagram, Spotify, and YouTube for more.
They really are an amazing resource. Okay, so let's jump right in. We've got some fascinating research here about how technology is revolutionizing healthcare.
Yeah, and we're going to be taking a look at everything from electronic health records to telemedicine and all the ways that IT is impacting your experiences as a patient.
And I think one of the first things that really stood out to me was this incredible statistic. Healthcare IT spending was expected to reach $40 billion by the end of 2011. That is a huge amount of money.
It really is. It signifies a huge shift in the industry, largely driven by things like the adoption of electronic health records or EHRs.
Yeah, those EHRs. It feels like just yesterday we were all dealing with those massive paper files at the doctor's office.
I know, right? But now everything's digital, and that transition, along with the rise of things like telemedicine, mobile health apps, and bioinformatics, it all required a ton of investment in IT infrastructure and software.
Well, and think about it, how much do you use your phone for health-related stuff now?
It's become such a big part of our lives, and that integration of technology into healthcare, it's only going to accelerate. IT already represents over 10% of the GDP of most developed nations.
Yeah.
And, the U.S. healthcare IT market back then was projected to grow something like 24% every year between 2012 and 2014.
24%, that's wild.
Yeah.
But it also makes me wonder, with healthcare spending as a whole going up, 20.5% in just 1 year, is all of this really sustainable?
That's the million-dollar question.
Right.
Because while all of these technological advances are leading to some amazing improvements in care, they definitely come at a cost. So finding that balance between innovation and affordability, that's going to be the key challenge going forward.
Totally. So, okay, we know that technology is a major force in healthcare, but how is it actually changing the way that healthcare is delivered? Your research mentioned something called the healthcare value chain.
Right, right. So the healthcare value chain, basically it's the whole process of delivering healthcare. From that very first moment you contact a doctor all the way to the final outcome of your treatment. And technology is disrupting every single stage of that chain.
Okay, so how? How is it disrupting things?
Well, think of it like this. There have been three major stages of change. First, there was classic disintermediation.
Classic disintermediation. What does that even mean?
So you know how in the past you had to go through your insurance company for everything? You need their approval even for the most basic stuff.
Yeah.
Classic disintermediation is when technology starts to cut out those middlemen. It lets patients access information and services more directly.
Oh, like being able to book appointments online without having to sit on hold forever.
Exactly. It's all about making things more efficient. And then there's remediation.
Remediation. So does that mean things go back to how they were?
Not really. Remediation is more about recognizing that some of those traditional intermediaries are still important, but we need to integrate them with technology to make them more efficient and more patient-friendly.
So it's like making the middleman work better, not getting rid of them completely.
Exactly. And that brings us to network-based mediation. This is where technology really comes into its own.
Okay, network-based mediation. What in the world does that mean?
It basically means using technology to create this connected network of patients, providers, and payers, allowing everyone to communicate and coordinate care seamlessly.
So like a social network, but for healthcare.
You got it.
Yeah.
Where you can share information with your doctor, schedule appointments, access your medical records, even connect with other patients who have similar conditions, all powered by health information technology, or HIT.
HIT. So that's like the engine behind all of this.
It is. HIT is basically all those technologies used to manage health information and deliver healthcare services. From electronic health records to computerized provider order entry systems to clinical decision support systems and even telemedicine platforms.
Wow. That's a lot. But it sounds like HIT is already making a huge impact on the healthcare system.
Oh, absolutely. It's revolutionizing how care is delivered, improving patient safety, streamlining processes, and empowering patients to be more involved in their own health.
Okay, so let's talk about some of the specific technologies that are driving this change. We've mentioned electronic health records a couple of times, but what else is out there?
Well, there are computerized provider order entry systems, or CPOE, which allow doctors to enter orders for medications and tests electronically. Then there are clinical decision support systems, or CDSS, which provide clinicians with evidence-based
That
recommendations.
sounds super helpful, especially the CDSS. It's like having a whole team of experts backing up the doctor's decisions.
You got it. And there's more. There's picture archiving and communication systems, or PACS, that allow for digital storage and retrieval of medical images. Then there's radio frequency identification, or RFID, which is used to track patients, equipment, and medications in hospitals, which improves safety and efficiency a lot.
It's amazing how much technology is working behind the scenes to make healthcare better.
Oh, yeah. And it's only getting more sophisticated. We're seeing things like artificial intelligence, machine learning, even robotics starting to be used in healthcare.
Wow. But before we get too far ahead of ourselves, let's bring it back to the business side of healthcare.
Oh, you mean how these technologies are changing the healthcare business model? Good point.
Yeah, it's not just about the tech itself, it's also about how it's changing the way healthcare is organized and financed.
Right. We're seeing a huge shift away from that traditional fee-for-service model, where providers get paid for each service regardless of the outcome. Instead, we're moving toward what's called a value-based care model. Providers are rewarded for improving patient outcomes and delivering high-quality care at a lower cost.
So it's about focusing on value over volume.
Exactly. And technology is playing a huge part in making that shift possible.
Can you give some examples of how?
Well, telemedicine, for one, it's making it possible to deliver care remotely, which can really cut down on expensive office visits and hospital stays. And then there's data analytics, which helps identify patients at risk of developing chronic conditions, which allows for early intervention and preventive care.
So it's not just about improving care, it's about making it more affordable and accessible too. But I imagine this shift to value-based care is shaking things up a bit in the industry.
You're right. There's a lot of innovation and experimentation going on as healthcare organizations try to adapt to this new landscape. And one of the biggest disruptions is the move of procedures from expensive hospitals to more cost-effective settings. Things like outpatient clinics, retail clinics, and even patients' homes.
Wow, that's a huge change. But I guess it makes sense, right? Who wants to go to a hospital if they don't have to?
I know, right. And technology is making that shift possible by simplifying procedures and making it easier to deliver care in all sorts of different places.
So what are the key things making that possible? What's allowing for this shift to delivering high-quality care outside of traditional hospital settings?
Well, there are three main factors. First, simplifying technology. Procedures that once required all sorts of complicated equipment and a specialized facility can now be done using portable, user-friendly devices.
That makes sense. What else?
Second, business model innovation. There are all these new models popping up that are focused on delivering care in more convenient and affordable ways.
Okay, and the third?
And finally, disruptive value networks. These are basically networks of providers, payers, and technology companies working together to deliver this really integrated, patient-centered care.
So it's like a combination of technology, new business models, and collaboration that's driving this disruption.
Exactly. And this disruption, it's leading to some pretty interesting changes in the way hospitals are structured and how they operate.
How so? What's the difference between the traditional general hospital model and this new focused value chain hospital you talked about?
Well, the traditional model is very reactive. It's like, we can fix whatever problem you bring us. But that approach is really expensive and often inefficient. The focused value chain hospital, though, is much more proactive and needs-based. It's like, when you know what you need, we'll provide it in the most efficient and effective way possible.
So it's about specialization and efficiency.
Exactly. It's all about delivering specific types of care in a way that reduces costs and improves outcomes.
Makes sense. And I'm guessing technology plays a big role in making that happen.
Oh, absolutely. Technology streamlines processes, coordinates care, and tracks outcomes, all to make sure that patients get the right care at the right time in the right place.
So we've talked about how technology is changing the delivery and organization of healthcare. But what about the internal workings? How is technology impacting the day-to-day operations of a hospital or clinic?
That's a great question. To understand that, we need to look at the internal IT business processes. These are the processes that support the delivery of care, from managing patient records to coordinating staff and resources.
So it's all the behind-the-scenes stuff that keeps everything running smoothly.
Exactly. And technology is transforming these processes too. Think about all the things involved in running a hospital. Marketing, logistics, operations, services.
And, of course, research and development and IT itself.
You got it. All those processes are connected, and they're all about delivering value to the customer, which in healthcare means providing high-quality care to patients.
So technology is optimizing those processes and improving the patient experience.
Exactly. And a great example of this is the GE healthcare operating model.
Oh, right. You mentioned this in your research. What is it?
Well, it's a model that balances standardization and integration across the entire healthcare organization.
Yeah.
And it's evolved over time, starting from a pre-hospital information system, or HIS stage, where things were more diversified and replicated.
So before hospitals had these fancy information systems, each department kind of did its own thing.
Pretty much. But as HIS became more common, the focus shifted to coordination and unification. The post-HIS stage of the GE healthcare operating model really emphasizes a much more streamlined approach to healthcare delivery.
Sounds much more efficient.
Yeah.
But I guess the more we rely on technology, the more risks there are, right? We can't ignore the potential downsides,
You're absolutely right. And one of the biggest concerns in healthcare IT is data security.
especially with all the data breaches and cyber attacks we hear about all the time.
Exactly. Healthcare data is super valuable to cybercriminals, which makes healthcare organizations prime targets.
So what are some of the specific IT risks that healthcare organizations are up against?
Well, there's always the risk of network disasters. Things like system crashes and power outages that can disrupt operations and put patient safety at risk. Then there are the pitfalls of social media, where careless posts by employees can lead to HIPAA violations. And then there are those more sophisticated security threats, like phishing attacks and ransomware.
Scary stuff. Sounds like healthcare organizations need to be really careful when it comes to cybersecurity.
No kidding. They need to invest in strong security measures, train their staff on best practices, and have plans in place to deal with potential breaches. And it's not just about protecting data from outside threats. They also need to make sure they don't lose access to critical IT applications like the HIS.
Right, it's about making sure the entire IT infrastructure is reliable and resilient.
Exactly. And of course, there's also the issue of complying with federal laws like IPT, which sets strict rules about protecting patient health information.
HIPAA is so important. It gives patients peace of mind knowing their information is being handled responsibly.
Absolutely. And it's up to healthcare organizations to make sure they're following all those rules.
Okay, so we've covered a lot of ground here. The big investments in healthcare IT, the risks, the challenges. What about the future? What are some of the exciting IT trends on the horizon?
Well, one of the biggest trends is the rise of cloud computing.
Cloud computing, you mean storing data and applications on remote servers instead of local computers?
Yep. Cloud computing offers a ton of advantages for healthcare organizations. Scalability, flexibility, cost savings, you name it. And we're seeing these healthcare-specific cloud platforms popping up, like the CareStream View Cloud.
So it's making it easier to share information.
Absolutely. And it's allowing the development of all sorts of innovative applications and services.
Cool. What about mobile health? Seems like everyone's using their phones for health stuff these days.
You're telling me the mobile revolution is transforming healthcare. We've got fitness trackers, symptom checkers, medication reminders, mental health support apps, telehealth platforms that let you talk to a doctor from anywhere.
Like having a doctor in your pocket.
Right. And the stats are pretty amazing. Did you know 17% of cell phone users use their phones for health information lookups? And cloud computing in healthcare is projected to grow, get this, at a compound annual growth rate of 20.5% from 2010 to 2017.
Wow. Mobile health is definitely here to stay.
Definitely. And it's not just patients embracing mobile technology. Doctors are using their smartphones for everything these days. Prescribing meds, accessing patient records, staying up to date on the latest research.
Yeah, that makes sense. Smartphones must be super useful for busy doctors.
Absolutely. And this trend is only going to get bigger as mobile technology becomes more sophisticated and integrated into our lives.
So cloud computing, mobile health, what other IT trends are we seeing?
Well, one that's particularly exciting is telemedicine.
Telemedicine, isn't that just video chatting with your doctor?
It's more than that. Telemedicine includes a whole bunch of technologies and services that allow healthcare providers to deliver care remotely. Things like video consultations, remote patient monitoring, even telesurgery, where surgeons can operate on patients remotely using robotic systems.
That's wild. I can see how telemedicine would be huge for people in rural areas or who have trouble getting around.
Absolutely. And the World Health Organization actually recognizes telemedicine as a really cost-effective way to deliver healthcare to everyone. It can really help bridge those gaps in access to care.
It's amazing to think about how technology is making healthcare more accessible for people all over the world. But I guess with all this advancement, we need to remember that not all IT implementations are successful. What can we learn from the times things haven't worked out so well?
That's such a good point. Not every healthcare organization has been successful in implementing new technologies, but by looking at both the successes and the failures, we can figure out the keys to getting it right. And one of the most important factors is strong leadership.
So having leaders who are on board with new technology and can guide the organization through the change process is crucial.
Totally. Leaders need to have a clear vision for how tech can improve care.
So it's not just about having the latest gadgets, it's about having the right people in charge to make it all work.
Exactly. Another critical factor is effective change management.
What does that involve?
It's about bringing everyone on board, communicating clearly, addressing any concerns, and making sure everyone has the training and support they need. Change can be disruptive, so you have to manage the process carefully to get everyone on the same page.
So it's not just about throwing new tech at people and expecting them to figure it out on their own.
Not at all. You have to bring people along on the journey and make sure they understand why these changes are happening and how they'll benefit everyone.
Makes sense. And I imagine it's also really important to focus on user needs.
Absolutely. The technology has to be designed and implemented in a way that actually works for the people who are using it. Doctors, nurses, patients, everyone.
So it's about making it user-friendly and making sure it actually makes delivering care easier, not harder.
Exactly. And that requires careful planning, collaboration, and a deep understanding of how everyone works and what they need.
Wow. This has been incredibly insightful. We've covered so much, and there's still so much more to explore. Stay tuned for part 2 of our deep dive into healthcare IT management, where we'll go even deeper into this fascinating world.
We'll be talking about the projected growth of the healthcare IT market, the impact of government policies, and the ethical implications of emerging technologies.
And a huge thank you again to London Heartbeats a Day Academy for their incredible support. Don't forget to check out their 140-plus healthcare courses.
You can find them online and on social media: Facebook, Instagram, Spotify, and YouTube. Be sure to subscribe to their channels so you don't miss out on any of their amazing discussions.
It's a fantastic resource for anyone who wants to stay on top of the latest developments in healthcare.
We'll be right back after a short break. Welcome back to the Deep Dive. Before the break, we were talking about how important strong leadership and effective change management are for implementing IT successfully. You can have all the fancy tech in the world, but if you don't have the right people and processes in place, well, it's not going to do much good.
Yeah, it's like having a Ferrari but not knowing how to drive stick. You're not going to get very far.
Exactly. And speaking of going far, let's talk about the projected growth of the healthcare IT market. The numbers are pretty impressive.
Oh yeah, for sure. One that really caught my eye was that the U.S. healthcare IT market was projected to grow by a whopping 24% year over year from 2012 to 2014. That's insane growth. You don't see that in many industries.
It really shows how much technology is changing things in healthcare, and there are several factors driving that growth. We talked about electronic health records, but the rise of those mobile health apps and the demand for data analytics are playing a big role too.
Data analytics. That's a fascinating area. It's about using data to make better decisions in healthcare, right?
Exactly. By analyzing huge sets of data, healthcare organizations can gain all sorts of insights. They can learn about patient populations, disease trends, how effective different treatments are, and even make their operations more efficient.
So it's about using data to make smarter decisions and improve patient outcomes.
Exactly. And we can't forget about the government's role in all of this. Initiatives like the Hate Tech Act, which gave financial incentives for healthcare providers to start using electronic health records, those have been super important in driving this digital transformation.
Oh yeah, for sure. Government policies and incentives have played a big part. And as more and more healthcare providers adopt these technologies, well, that market is only going to keep growing.
Definitely. It's a pretty exciting time to be involved in healthcare IT. So going back to some of those specific technologies driving this growth, I think it's worth emphasizing just how impactful electronic health records, or EHRs, have been.
For sure. They've completely replaced those old paper charts.
And for good reason. EHRs have revolutionized how patient information is stored, accessed, and shared. They've led to huge improvements in patient safety, care coordination, and efficiency.
For me, the biggest thing about EHRs is the reduction in medication errors. It's a lot harder to misread a doctor's handwriting when it's all typed out electronically.
That's a great point. But EHRs can do so much more than just digitize those records. They can provide clinicians with alerts about drug interactions, reminders about preventative screenings. They can even give access to the latest research and clinical guidelines.
It's like having a massive medical library right at your fingertips.
Exactly. And EHRs are making it easier to track and analyze patient data, which is super important for improving the quality of care and spotting trends in population health.
So it's not just about individual patients, it's about understanding the health of entire populations.
You got it. And that brings us back to telemedicine.
Oh yeah, telemedicine. We touched on it briefly before, but I'm really curious to hear more about how it's being used to reach more patients and improve outcomes.
Well, it's a game changer, especially for folks who live in rural areas or have trouble getting around. It allows patients to connect with healthcare providers from anywhere using video conferencing, phone calls, or even mobile apps.
I can definitely see how valuable that would be for someone who lives far away from specialists or has a hard time leaving home.
Absolutely. And it's not just about convenience. Telemedicine can actually improve the quality of care because it makes things like remote patient monitoring possible. That means things like vital signs and other health data can be tracked remotely, allowing providers to step in early if needed.
So it's about bringing healthcare to the patient, not the other way around.
Exactly. And that's where mobile health, or mHealth, really shines.
Health. I've heard the term, but I'm not totally sure what it means.
So mHealth is all about using mobile devices like smartphones and tablets to deliver healthcare and information. Things like fitness trackers, symptom checkers, medication reminders, even mental health apps.
Like having a health coach right in your pocket.
That's a great way to put it. The potential for mHealth is huge. It empowers patients to take control of their health, connects them with providers in new ways, even helps with things like clinical trials and research.
Oh, it's really blurring the lines between healthcare and everyday life.
It is. And it's not just impacting individual patients, it's transforming whole healthcare systems. We're seeing this big shift towards value-based care, where providers are rewarded for getting good results instead of just providing more services. And technology is making that shift possible.
Can you give us some examples of how that's happening?
Sure, data analytics can help identify patients who are at higher risk for certain conditions, which lets providers step in early and hopefully prevent more serious problems down the road.
So it's about being proactive instead of reactive.
Exactly. And telemedicine can make managing chronic conditions a lot easier and less expensive. For example, someone with diabetes could use a telemedicine platform to share their blood sugar readings with their doctor, who can then adjust their treatment plan without needing an office visit.
It's incredible how technology is improving quality, affordability, and accessibility all at the same time.
It's definitely a win-win. And as technology continues to advance, we can expect to see even more innovation and change in the healthcare industry.
But of course, as we've talked about, there are risks that come with healthcare IT too. Things like data breaches and the possibility of systems crashing.
You're right. Cybersecurity is absolutely essential in healthcare. Organizations need to have strong protections in place to keep that sensitive patient data safe. Things like firewalls, intrusion detection systems, encryption, multi-factor authentication. It's a lot.
And it's not just about hackers, right? There's always the risk of human error or accidental disclosure too.
That's why training and awareness are so important. Everyone in a healthcare organization needs to understand how important data security is and know how to protect patient information.
What about things like contingency plans? What happens if a system crashes or there's a natural disaster?
Healthcare organizations need to have plans in place to keep things running smoothly, even in emergencies. That means having backup systems, disaster recovery procedures, and clear communication protocols.
So it's not just about preventing bad things from happening, it's also about being ready to respond when they do.
Exactly. It's a constant challenge for healthcare organizations everywhere.
So it's this ongoing process of adapting and innovating. They need to stay ahead of the game when it comes to things like cybersecurity, data privacy, and new technologies.
Absolutely. Healthcare is constantly evolving, and the organizations that are willing to embrace technology and adapt to new challenges, those are the ones that are going to succeed in the long run.
This deep dive has been amazing. It's given us such a great overview of healthcare IT.
It really is fascinating to see how technology is transforming healthcare, from how care is delivered and managed to how people access it.
And for our listeners, I think the main takeaway is that healthcare IT isn't just some industry trend, it's affecting you directly. From how you interact with your doctor to the tools you use to manage your own health, technology is changing the game.
And it's super important to stay informed about these changes, understand the pros and cons, and be proactive about managing your health in this increasingly digital world.
Okay, so before we jump into the final part of our deep dive, let's take a moment to thank London Heartbeats Z Academy for their incredible support in making this all possible.
They really are doing great work to make world-class healthcare education accessible.
Be sure to check out their website where you'll find over 140 healthcare courses designed to help you learn and grow.
And don't forget to subscribe to their social media channels on Facebook, Instagram, Spotify, and YouTube for regular updates and insights into the latest healthcare trends.
It's a fantastic resource for anyone who wants to stay ahead of the curve in healthcare.
We'll be back in a flash to discuss the future of healthcare IT and explore some of the ethical questions around all these advancements.
Welcome back to the deep dive. It's wild to think that technology isn't just changing the tools and processes in healthcare, but like the whole philosophy of care. We've gone from paper records to digital, from fee-for-service to value-based.
Oh, it goes even deeper than that, right?
No, absolutely. We're moving away from just reacting to disease, to actually being proactive and focusing on wellness.
Yeah.
And technology is a big part of that shift. It's letting people take charge of their own health.
It's like we're shifting from just treating illness to actually preventing it in the first place.
Exactly. Think about it. All the tools we have now, like 10 years ago, we wouldn't have even dreamed of them. Wearable devices, mobile health apps, telemedicine platforms that let you talk to a doctor from anywhere.
Yeah, it's like having a whole team of medical experts in your pocket.
Right. And it's not just about information. It's about empowering people to make informed decisions about their own health.
So it's like a partnership between patients and providers, and technology is what makes it possible. Exactly. And that partnership is leading to some really exciting things, like personalized medicine.
Personalized medicine, what's that?
It's about tailoring treatments to a person's genes, lifestyle, environment, everything that makes them unique. So like, instead of using the same cancer treatment for everyone, personalized medicine lets doctors choose therapies that are more likely to work based on the individual's genetic profile.
Wow. That's like a custom-made treatment plan just for you.
Exactly. And it's technology that lets us gather and analyze all that data to figure out these targeted therapies.
So data is driving innovation and improving outcomes.
It is, but of course it also brings up some ethical questions about data privacy, access, equity, things like that.
Yeah, those are important things to think about. How do we make sure everyone benefits from these advancements, but that their information stays protected?
That's the tough question. There's no easy answer, but it's definitely something we need to be talking about. The potential benefits of all this stuff are huge, but we have to be smart about it.
One thing's for sure, the future of healthcare is definitely digital.
Absolutely. And the people and organizations that are willing to embrace technology, adapt to all these changes, they're the ones who are going to shape healthcare in the future.
It's really exciting to think about all the possibilities.
I know, right? Who knows what we'll be able to do down the road? Maybe we'll cure diseases that seem impossible now. Maybe we'll even figure out how to extend human lifespan. Maybe we'll finally create a healthcare system that truly works for everyone.
It's incredible to be living through this time of such huge change in healthcare.
It really is. And if you're interested in learning more about this exciting field, definitely check out London Heartbeats Z Academy.
They're a fantastic resource for anyone who wants to stay ahead of the curve in healthcare.
They have over 140 healthcare courses, and they're on social media too. Facebook, Instagram, Spotify, YouTube. Go check them out.
Well, that wraps up our deep dive into healthcare IT management.
It's been a pleasure exploring all of this with you.
We hope you've enjoyed it and learned something new. Until next time, stay curious and stay engaged in shaping the future of healthcare.